Hi everyone, Jennifer here from Good Health Physical Therapy. So even for those of you who struggle with hypermobility, you can still suffer from things like frozen shoulder. So today I wanted to go through a few simple moves for any of you who might be dealing with this, but also need to be careful with the mobility of maybe the other shoulder. So just some nice gentle range of motion movements. So I'm going to start with your hands out to your sides, just maybe a little below your shoulders. One palm up, one palm down. And we're just going to start with rotating up, and rotating one down. You want to make sure that you're not over-rotating and bringing that whole shoulder forward. So just imagine, really try to visualize that arm bone inside of the shoulder socket. And visualize it rotating forward and back. So if you have the whole of your shoulder joint and the arm, it's just rotating inside that socket, nice and gently. And if it feels manageable, you can take this up one notch, taking the back of one hand to the small of your rack and the palm to the back of your head. And then switch, palm to the back of the head, back of the hand to the small of your rack. And the next one we're going to do laying down, and there's going to be two components. You're going to lift into a little bit of extension while pulling the head back. Note that I am not tilting my chin up for this one. I'm pulling the head back in space as I pull my arms down. And to engage the core for this one, when you start, think about engaging like you're trying to lift your belly off of the floor, because we don't want to take this action just in the low back. Starting with your arms over your head. Engage the core, so the glutes a little bit tongue. Lifting the shoulders, the head up a bit as you pull the arms down. Remember, no chin tilt up, lifting from the back of the head. Okay, and the next one will be back to standing up. And again, just gentle range of motion. My thumbs are forward. So I'm going to take my arms up into a Y shape. And then I bring my arms behind me. And note when you bring your so you want to keep your spine neutral. So when you're doing this part, you're not just arching your back. I also want you to make sure you keep your shoulder back. And focus on opening up the chest. So you might stop here. And sometimes if you go further and there's some tightness through the chest, which often is the case with those of you with hypermobility, then the shoulder will come forward. But what we're looking for here is to open up, so to encourage that true extension range of motion. Up to a V, ribs down, and down to an A. Up to a V, and down to an A. My spine is staying neutral. I'll show this from the side. I'm going to add one more from your hands and knees. This on your palms isn't comfortable for you. You can make a fist. Don't be here too long, so maybe 5 or 10 repetitions on each side. One hand to the back of my head. I'm going to turn. And then turn the other way, bringing my elbow towards my opposite forearm. Make sure you keep your belly lifting. We want to keep the rotation kind of in the midsection, like think ribs turn, the rib cage turns. And make sure you match the repetitions on the other side. Lift and reach. And I like to coordinate this with my breath. Inhale. And exhale. All right, there's just a few range of motion exercises for nice, healthy shoulders. This is not to replace any exercises or movements your PT has given you to work on. This is maybe just something you can add on, just to add some gentle, mindful movement throughout the day for the health of your shoulders. Thanks for watching. Have a great day.